Hi, I'm Narula. I'm a cardiologist, CBS News senior medical correspondent, and American Heart Association volunteer. Welcome to this celebration of 40 years of advocacy impact. I'm so honored to be part of this celebration, a celebration like no other. For 40 years and counting, the American Heart Association has advocated in support of public policies that promote cardiovascular health and address health disparities in order to equitably improve health for everyone, everywhere. During this special program, I have the privilege of honoring the relentless contributions of grassroots advocates, volunteers, and staff who've made so many important accomplishments possible. The American Heart Association's grassroots advocates and volunteers are the lifeblood of its advocacy work. So in true American Heart Association fashion, throughout the program, you'll hear inspiring stories of people across the country who personify advocacy work in action. We'll also celebrate previous advocacy successes that have made a profound impact on millions of people and families nationwide. And we'll hear from the association's executive leaders about their vision for the future of advocacy. This celebration is about you, the advocates and volunteers who make this organization an advocacy force to be reckoned with in Washington, D.C., and in states and communities nationwide. As we celebrate all that we've accomplished together, I'm so personally grateful to each of you. Whatever your role, it is making a difference. It's a big deal. Each of you who shares your personal story as a cardiovascular disease patient, caregiver, loved one, researcher, you are an advocate because you are willing to share your story with the world. Thank you. We celebrate your health and your perseverance. As we look back at our accomplishments, we also remember those we have lost to cardiovascular disease and stroke. In their memory, we stand firm in the knowledge that advancing our mission will benefit our children and our children's children. Tonight's program is both a celebration and a look ahead. While we've accomplished so much at the federal, state, and local levels, we also recognize there's much more to do. To kick things off, I'd like to welcome Aquiline Kennedy, an unstoppable advocate for healthcare access. As a college student, she had a stroke, followed by open heart surgery. She started her own business before getting sick and being dropped by her health insurance company. Those events led her to testify before Congress in 2013 in continued support of the Affordable Care Act, the landmark law that has made it possible for millions of uninsured people to access health care. Here is her story.
My name's Aquiline Kennedy. I'm from Texas, and I went to college in Atlanta, Georgia. My freshman year of college, I was walking across campus. It was actually 1 month in. I was walking across campus and I felt a pop. And I didn't know if I felt it or if I heard it. I just knew something strange happened. And everything around me looked a little bit different. The trees and the grass were greener than I'd ever seen before. Things were just extremely vibrant. I went on to class and realized thereafter I couldn't speak. It took another day, Sunday, that I was home until I got to Emory University Hospital on Monday morning. And at that time, a neurologist did a few tests on me and determined that I'd had a stroke. So I have been living as a pre-existing condition since I was 18 years old. I'm now 49. But when I realized that people like me were being denied coverage and were being mistreated for things that really weren't our fault, we tried to have insurance and we tried to have everything that we needed. I was really motivated to kind of get involved. Writing op-eds for Congress. This was right before the 2008 elections, and healthcare reform was a really big deal. So I wrote my story. I actually had an opportunity later to go speak to Congress and tell my story, and that all happened because of the American Heart Association. Fast forward to 2013. Not had insurance. I'd actually lost my insurance, and one of the things that I found was every time I tried to get insurance, they told me, the insurance company said, well, you should actually apply for the new plan, the PACA, so it's the pre-existing condition insurance plan, the ACA basically. So in order to apply, I had to be uninsured for 6 months. Well, I'll tell you this, I got my insurance card in April, and in May I had my first heart attack. Because I had my card, and I had my card because of the Affordable Care Act, and the Affordable Care Act existed because of the work that had gone into it for so many years, thanks largely to the American Heart Association, I actually survived. And while everything's not perfect about it, it saved my life, and I'm so thankful for that, and it saved millions of others as well. American Heart Association is definitely relentless in its pursuit of making sure that survivors like me can live the best lives possible.
Next, I am pleased to welcome American Heart Association CEO Nancy Brown in conversation with two of our exceptional leaders from the past. Dudley Hafner served as CEO from 1980 to 1997, and Cass Wheeler served as CEO from 1997 to 2008. Both had a transformational impact on the American Heart Association and its advocacy efforts. Nancy, we're excited to hear from these notable leaders who were there when it all got started.
It is such an honor for me to be here today with two legendary leaders of the American Heart Association, my two immediate predecessors, Cass Wheeler and Dudley Hafner. So let me start, Dudley, with a question to you. You were the visionary of creating advocacy in the American Heart Association. How do you feel about the fact that we're celebrating 40 years? What does that mean to you?
Well, first, I wasn't a visionary of this. I think I inherited a desire from the 70s of a number of volunteers that said we had to change, the organization had to change its approach to advocacy. And what I've heard today and how it's blossomed, has grown, is just incredible, just absolutely incredible.
And Cass, 40 years of advocacy, what does that mean to you? How do you feel about that fact that we're celebrating this?
I remember early on as the CEO going to DC on a regular basis and how energized I was at the opportunities and the difference that we were making.
Dudley, in your tenure, we opened the first federal advocacy office in Washington, D.C. shortly after you became the CEO. What inspired you to do that? What were you thinking and hoping that would accomplish for the AHA? And how do you feel about what it has accomplished?
Well, since I walked the halls there for about 17 years over the tobacco issue, I learned, that you don't get into some of those offices unless you have a relationship. Our science, the basis of our science was critical to our organization, but it was only when we stepped outside of science to use it for the public and the public's good that we started making a true impact on the health of the American people.
Well, let's switch topics to research. It has been such a critical advocacy priority. Tell us about research advocacy in your tenure.
Well, certainly doubling the NIH budget was a big thing that we were certainly leading. Science has been the foundation and has given us the credibility so that when we spoke on the Hill, that people listened and they knew that we had credible science to back up what we said, and that's where we built our trust.
I'm very proud of how today, in 2021, the American Heart Association has built upon what both of you created. Today we have a unified advocacy organization from a staff point of view. The most highly skilled executive leaders, running the advocacy operation, and volunteers who are so passionate at the board level, at the advocacy committee, and in every local division of the AHA. And none of that would be possible if it weren't for the ground that both of you set for us to take it and take this to the next level. Cass, what about you? What would your dream be for us for our future?
That you double the budget. That you literally get an outside grant that doubles the budget
Well, there you go. We will take that as our marching orders into the future. Cass Wheeler, Dudley Hafner, thank you for being with us to celebrate what you both created and the 40th anniversary of the American Heart Association's advocacy. We're so honored you were here with us today.
Now we will hear from U.S. Representative Joyce Beatty of Ohio. Congresswoman Beatty always has been a groundbreaker. She was the first in her family to go to college, the first woman to represent her Columbus district in the Ohio House, and the first female Democrat to lead the Ohio House. A stroke survivor, her first stroke was 21 years ago, and she has taken on enormous responsibility, not only as an outspoken member of Congress on the need to achieve health equity, but as the chair of the Congressional Black Caucus. As a former board member of the American Heart Association, Congresswoman Beatty knows firsthand the critical importance of advancing science-based policy solutions to address the challenges we face as a nation.
I am so proud of the American Heart Association because they understand that we must look at all of the inequities. We must look at the disparities in our numbers, and they realize when you look at heart disease and when you look at health care for those who are disadvantaged, for those Black Americans, we know that there are disparities in treatment. We know that the data speaks to us about the things and the information and the awareness that's not in many of their communities. So what have they done and continue to do? They bring people like me to the table. I'm a stroke survivor. They allowed me to come and tell my story across America, but more specifically, it allowed me to talk to Black women and Black families and to tell them the value of being engaged with the Heart Association, of reading the data and the information that's provided. So just as I tell people to listen to your bodies, the Heart Association listened to me. When I think about what we do here in Congress, writing legislation that will help others, especially when we talk about cardiovascular disease and we talk about the American Heart Association. Having the back of a scientific research organization gives credibility to the legislation, that we're all in this together. We just have to work together. We have to value our diversity. We have to understand our cultural differences, and together, providing diversity, inclusion, and equity really has made a difference in the history of the Heart Association, and it also has saved lives. But to take their data, their research, their information, and marry it with our public policies, and that's how legislation serves others the best.
As an evidence-based organization, the AHA bases all of its recommendations on the latest science. The scientific research we fund is essential to improving the health of all people. Research drives a deeper understanding of how we can save and improve more lives. In all of this, advocacy plays a critical role. Whether the issue is smoke-free air, access to quality health care, or CPR graduation requirements, the AHA consistently takes a courageous stand on behalf of consumers, patients, and their families. The association has a well-established framework for building relationships and sharing critical information with lawmakers. That framework enables the association to meet its challenges of the moment through planning, data and research, fundraising, strategic coalitions, grassroots advocacy, media and direct outreach to decision makers. Policy change comes to life through the incredible work of advocates who participate in the association's You're the Cure grassroots network. Thanks to you, our AHA advocates and volunteers, we're celebrating these groundbreaking results today. Speaking of meeting the moment, I'd now like to introduce Kristen Williams. Kristen was a heavy smoker in college. One Saturday during a University of Oklahoma football game, she suffered a ruptured aneurysm, leading to a pulmonary embolism. She is passionate about heart health and the Black community, especially the injustice of the tobacco industry's marketing tactics, which have had a disproportionate impact on her community.
My story with the American Heart Association starts in October 2011. At the time, I was a student at the University of Oklahoma. I was going about my day, very normal. I was preparing to go to a football game, to go watch the University of Oklahoma play Ball State. I was going out with my friends, same thing as every single day. I woke up in the morning, had a cup of coffee, had a cigarette, went out. We were sitting down to eat somewhere, and all of a sudden I felt really strange. So I called my boyfriend at the time, now husband, and said, I think something feels a little bit off. And he put his hand on my chest, and suddenly he said it felt like 1,000 grenades were going off. So at that point, he decided that it was something that we probably needed to pursue and decided to go to the hospital. They started running all kinds of tests. The first thing that they noticed is that I'd had a pulmonary embolism, or a blood clot in my lung. At this point, they were kind of confused. I told them I was a smoker, pretty heavy smoker, and so they were less confused at that point. And the one thing that everyone agreed on, no matter where I was that I absolutely had to quit smoking. That was a really horrible thing, and that no matter what the cause of it was, that it was a serious threat to my health before and also going forward. Quitting smoking was extraordinarily difficult. It was a part of everything I did. People around me continued to smoke. And when I started this advocacy, sharing my story, participating in campaigns to stop the sale of menthol cigarettes in San Francisco and other cities in the Bay Area, I really learned a lot about how the tobacco industry targets people, particularly people of color. I'm now the Young Professionals Board Chair, and I have continued to participate in advocacy, including the lobbying day in Washington, D.C. I really stay motivated because I learned more about the impacts that nicotine and tobacco had on youth, and particularly on people of color. You know, that when I understood the way that it threatened me, particularly how a lot of my friends were being targeted, how, you know, my family was being targeted by the tobacco companies, it made me really want to help teach other people. So when I learned really what it is that the American Heart Association did, beyond just, you know, being a fantastic charitable organization, it's something I wanted to be a part of. I understood that the surgery, the systems of care, the laws that protected people with pre-existing conditions or heart issues were the result of the amazing work of the American Heart Association. And because of that, it's something I really wanted to continue to support in any way that I could.
Let's hear from former Arizona State Senator Heather Carter, who served in the Arizona legislature from 2011 to 2020. She has long been a fierce advocate for policies that reduce tobacco use. Both in the Arizona legislature and out of it, Senator Carter is a champion for the health of Arizonans and a shining example of how AHA's state-level advocacy can create lasting impact.
So when I first ran for office in 2010, I wanted to become a health champion for the people of Arizona. And it's important as an elected official that we hear from our constituents and we understand the challenges that they face day in and day out. And unfortunately, when it comes to heart disease, this is a common challenge we hear across not only the state of Arizona, but across the country. So it's those personal stories that really bring a fine point to the policies that we are trying to advance. We need to understand as elected officials how the decisions we make in office affect those we serve. And so by sharing your personal stories, It takes a policy that may be on paper into somebody's personal life. And that way we can fully understand the impact of the decisions we make as elected officials. So if I can say one thing to those watching, advocacy is a critical component to shaping public policy. And it's hearing from individuals and their personal stories that really helps lawmakers do a better job serving their constituents. And when you look back over the last few years on some of the most important debates we've had in health in Arizona, I'd like to highlight the work around tobacco cessation and addressing our youth vaping crisis. The American Heart Association, in partnership with a number of other philanthropic and nonprofit organizations dedicated to health, was at the front of the fight, pushing back against big tobacco. And by working with a trusted partner like the American Heart Association, I was able to access research and science, and probably most importantly, those constituent stories about the impact of the legislation we were faced with at the Capitol. And so I just want to thank you, the American Heart Association, the staff and the volunteers. Your advocacy plays an important role at shaping the future of healthcare in America.
Everything we're hearing today reminds me just how strong we are when we work together. And in that same spirit, I have an ask of you today. The COVID-19 pandemic has underscored the serious gaps in our public health system. Put simply, we were woefully unprepared for COVID-19. Lawmakers must prioritize our health security and provide robust, sustained funding for the Centers for Disease Control and Prevention to prevent and protect all of us from public health threats, including chronic diseases like heart disease. Here's how you can tell our lawmakers to prioritize our health. I bet you have a smartphone nearby. Pick up your smartphone and text CDC to 46839 or scan the QR code you see on the screen. You'll get an immediate response and you'll be taken to an action page where you can contact Congress now about this issue. Thank you all for taking this action today. Be sure to share this on your social media accounts to encourage your friends and followers to join you. We now turn to Jennifer Griffin, a mom who embodies resilience. Jennifer and her husband Joel's daughter Gwyneth passed away at age 12. She could still be with us today if bystanders at her school had known CPR, and if the school had been outfitted with a working AED. Jennifer and her family are determined to ensure that every high school student is CPR certified upon graduation, and that schools are prepared to handle emergencies like Gwyneth's.
I became involved with the American Heart Association in honor of my daughter Gwyneth. I decided to become involved as an advocate with the AHA following the collapse and subsequent death of my daughter. Following her passing, we learned that not every school had an AED and teachers were not required to be trained in CPR. And for us, that was something that needed to be changed. So my daughter was 12 when she collapsed while running around the track at school. Unfortunately, individuals don't know how they're going to respond in an emergency situation, and a significant amount of time passed before Gwyneth received help. The American Heart Association empowered me following her death to become an advocate by educating me personally on the CPR in Schools initiative. Gwyneth was a kind, caring, and compassionate young lady, and she would do anything for anyone. Gwyneth's Law contains 3 components. The first component is that teachers are trained in hands-only CPR. The second component is that AEDs are available in all schools. And the third component is the requirement for students to be trained in hands-only CPR as part of a graduation requirement. We started at the grassroots level with who did I know in my community that could help me get to where I needed to be. And the American Heart Association then came in and said, we have the part that we think can help you, and that would be the CPR in Schools initiative. And they joined forces with my husband and I and our local legislators, and we headed off to Richmond to create Gwyneth's Law. At no time was I ever concerned that this wasn't going to become a reality, because as a mother, I was not going to allow it to fail. I was not going to give up. The more individuals that are trained, the more likely people will survive a cardiac arrest. And over time, that number of individuals within our own community is going to do nothing but just grow. One of the biggest accomplishments, besides the training of 10,000 individuals and 70 AEDs, is that to date, and based on our knowledge, 7 lives have been saved. I wasn't at school that day, so there was nothing that I could do to help Gwyneth. So the best way I knew how, given the cards that I had to help Gwyneth, was to at least help her legacy to live on. And helping that legacy live on meant closing the loophole in something that was left open. If I had to describe the American Heart Association's advocacy team in one word, it's influential, and they get things done.
As advocates and volunteers for the American Heart Association, we all have our own why, and I want to take a short moment to share mine. My dad is a cardiologist, so cardiology pretty much runs in my blood. As an advocate for women's health, physician, journalist, wife, and mom, I'm passionate about ensuring a better future for my patients, my kids, and all Americans. As we've said throughout this broadcast, our 40th anniversary presents the opportunity to celebrate our advocacy successes and set our focus on the work that remains to be done. The future of advocacy at the AHA will certainly be dynamic, while remaining principled to the values and mission of the organization. It will remain science-based, equity-focused, and impact-oriented. Let's hear once again from our CEO, Nancy Brown, joined by Keith Churchwell, Chair of the Advocacy Coordinating Committee, to understand their vision of how advocacy will help us transform and improve cardiovascular health for everyone.
It's such an honor for me now to be here with Dr. Keith Churchwell, who is chairman of the American Heart Association's committee that oversees our advocacy function and also a member of our board of directors. And of course, in his day job, Keith serves as the chief executive officer of the Yale New Haven healthcare system. You know, we're sitting here today celebrating 40 years of advocacy for the American Heart Association, which is really incredible. And when I think back over those 40 years, I know how much we have influenced public policies at the federal, state, and at the community levels. Today, we're here to talk about the future of advocacy and what contributions we might make in the future as we continue our mission and goals. I'd love your perspective on where we're heading as we move forward.
What we are seeing is that we are playing an even more important role, not only at the local level, but the regional and national level, of advocating for issues and opportunities for the improvement of care that actually had been on the table for years. We are actually crystallizing and actually better defining what those issues are and what the opportunities are around health equity, disparities of care, clinical opportunities in terms of improving care for actually all populations. And also understanding that our voice is actually incredibly powerful in this space, that people believe what we say. We actually, with the leading of science and in the understanding of the issues on their totality, both in terms of the outcomes of what we're trying to accomplish, but also the impact it's having at the local and our local communities and with populations. Our work is actually complete, is unfinished, and it's a great opportunity for us because we have great influence in this particular arena.
You know, you talk about influence and trust and how much people believe the American Heart Association with science as our foundation. Part of the trust is our reputation working across political parties and, beliefs that people have about how things should be and what is fair and just.
So I think the phrase that trust is hard to gain and is easily lost. There is a spectrum of individuals that is broad that this appeals to. That it's not a conservative issue, it's not a liberal issue, it's not a moderate issue, it's actually a people issue in regards to how we're going to improve the overall lives, clinically, and the health lives of the individuals that we support. That message, I think, resonates with just about everyone.
You have been a tremendous leader for the AHA as we work to confront structural racism as a cause of premature death from heart disease and from stroke. Talk to us about how advocacy can really propel these efforts.
Our work actually at multiple levels, at the clinical and at the research level of understanding the issues of disparity and actually testing the hypotheses ultimately that actually shows improvement or non-improvement, and actually that we can actually then bring to the table of those things that can change and should change is incredibly important. Number two, actually bringing constituencies together that actually can be disparate, who are working in this particular field, and convening them in a way that actually amplifies the voice and amplifies the opportunity, I think is key. And as actually as a role in the advocacy space and the American Heart Association space that we do extremely well.
Without volunteers, the American Heart Association achieves nothing. And volunteers have played a profound role in our success in advocacy over 40 years.
They live in the communities that actually are affected by the policies. So they are a trusted voice. They are the people that those in positions of power and influence will listen to. And then without them actually being able to put a message together, to understand the process and the problem, to actually get investment about how do we bring ideas and solutions to the table that we may not have thought of actually in Dallas is incredibly important. I would say that the Presidential Advisory Paper is a great example of that.
What excites you when you think about the future?
What excites me is that there's still so much work to do. The burning platform for us is every single day the opportunities to continue to advance the ideas and the causes that we actually so much believe in. And there is so much for us to do, whether it be the tobacco endgame, health equity, social disparity, the advancement of science, and the investments that needed actually at the local, national level to be able to articulate the need to actually bring solutions to these particular problems, to invest in others coming forward and coming with us, having them understand their particular role and joining with them. It is really an exciting time to be part of the advocacy committee and to be part of advocacy for the American Heart Association.
You know, Keith, I couldn't agree with you more. And when I think about the future of advocacy in the AHA and think of the large goals that the board has set for the association, we will not achieve those goals without a strong, robust advocacy function in the organization. And I know that as we move forward into the next 40 years of success in advocacy at the American Heart Association, we will continue to leverage our brand, our science, and our grassroots to change public policies for all people to have an equal chance to have a long and healthy life. Dr. Keith Churchwell, thank you for this wonderful conversation today. It's always a delight to hear from you directly about your vision for advocacy at the AHA, and we will celebrate and we will continue the good fight.
Those inspirational thoughts are a vivid reminder of how advocacy will continue to define and shape the work of the American Heart Association. As we close our program, I want to once again ask you to raise your voices in support of equitable health for all. Join us in action by texting CDC to 46839 or scanning the QR code you see on the screen. The results continue to come in. Don't forget, we need everyone to participate. Make sure your voice is heard and your opinion is counted. The American Heart Association is incredibly proud of the impact that you and all our volunteers have helped make possible. There is so much at stake, whether it's your own health or the lives of your children, family, friends, or coworkers. And we've never been more prepared than now to stand strong for heart and brain health. The human spirit is amazing. Our resilience in the face of great challenges is what defines us. Together, we have the power to change public policy to improve lives. Together, we are stronger, wiser, and healthier. Together, we are relentless. Thank you for all you do.